And this is a mental health moment with Rogers Memorial Hospital. Today we celebrate Mental Health Month by putting the spotlight on nurses and the extraordinary role that they have in making a difference in the lives of people who are struggling with mental health issues. Diane Miller is the Director of Nursing at Rogers Memorial Hospital in Brown Deer. It's great to see you. Thank you so much for being here.
Thank you.
And I was thinking about the fact that May is Mental Health Month, and I know that the second week of this month is National Hospital Week and then also National Nurses Week. And a lot of us think about psychologists, psychiatrists even, but we don't think about the role of nurses. It was good for me to learn more about this.
Yes. We are celebrating in Brown Deer, our Brown Deer Hospital, we're celebrating Nurses Week, Hospital Week, Mental Health Awareness Month, our one-year anniversary for Brown Deer.
It's wonderful.
So yes, nurses, we just interviewed thousands of people for our new hospital, and we had thousands of applicants. We interviewed over 1,000, and we hired about 250 staff, and many of them are nurses.
That's wonderful that
Yes.
you've been able to be selective and that you had such a great pool of people to select from.
Yes.
Talk about two things, if you would, because, you know, just like medical settings, nurses have a vital role in caring for patients in the setting that you're in the mental health field.
Yes.
So one, talk about being an advocate, and then also talk about caregiving as it relates to mental health.
Okay. Well, the caregiving with mental health is, well, let me say a few words about Florence Nightingale, who is the sort of the mother of nursing, and she was the founder of modern day nursing. One thing we're doing in the Brown Deer Hospital is we're using a lot of the concepts that she believed in, and that's taking in light and nature and healing. We've designed our hospital to bring in those aspects of...
Yeah, and we're looking at a picture of it. I'm glad you mentioned that specifically, and thank you for sharing these pictures, by the way, because these concepts are truly innovative,
Yes.
I think, as it relates to mental health. So what are we looking at in these pictures? It's beautiful.
So what we're looking at is that we're taking the concepts of nature again. So we have a living wall, we have skylights, our units are decorated with a lot of nature. We have outside areas for our kids, our adolescents, our adults. We try to get people outside. One thing that the nursing and the rest of the hospital is doing is some therapeutic gardening. We're having our patients get involved in gardening and planting because it's very healing. So there's just a nature theme to our program.
And I just love what you're doing. I mean, and I never knew that Florence Nightingale was considered to be not only the founder and champion of nursing and very much associated that with championing daylight and fresh air and some of those things that are critical for all of us to have wellness mentally.
Yes. Florence actually, even though she was a nurse, she spent 2/3 of her life homebound in bed because she had contracted a fever when she was helping the soldiers. And she became a consultant to hospitals all over the world, and that's what she taught. If you bring in light and you bring in nature and you bring in fresh air, you will fight disease, mental illness as well as other illnesses. And she was a leader for hospitals around the world.
It's exciting that we have a place like Rogers so close to us and accessible to us here in Wisconsin in this new Brown Deer location. It's exciting that you're celebrating this anniversary. Touch on just briefly, if you would, the advocacy part of nursing and how you advocate for patients.
We advocate for patients because we're the ones that are with the patients 24/7, of course. So the other disciplines come in during the day. We have group, ET, social work. We have every discipline you can imagine in a hospital, but the nurses are really there 24/7. So our patients, whatever their needs are, it's on us to communicate that with the rest of the interdisciplinary team, and also to be there with the families and advocate with if it's kids, their parents, their friends, their family. We have the continuum of care at Rogers, where we have the inpatient and the outpatient program.
Yeah.
So we need to speak to the nurses on the other side if the patient is going from inpatient to outpatient or likewise. So we really help that patient and advocate what their needs are, basically.
And I bet for you it's very rewarding because we believe in hope and healing as it relates to mental health. And I bet for you to see young people or even adults sort of work through the process of overcoming whatever challenges they have from a mental health standpoint and go on to lead happy and healthy lives.
Yes, yes. And that goes back to our nature theme and the gardening that we're doing.
Yeah.
There's something with getting your hands dirty and growing something that gives you hope. And a lot of the patients that come to us don't have hope, and that is why they're with us. They don't see anything beyond today. There's a high rate of suicide. There's kids with a lot of anxiety. There's a lot of mental illness out there where where the patient just lost their hope. So that's what we try to do for them.
I love that you give them that. And I'm so excited to learn more about nursing as it relates to this field. Thank you so much
Thank you.
for joining us and sharing it. And happy National Nurses Week.
Thank
It's
you
a
so
wonderful time for us to celebrate what you do and the wonderful work that you do at Rogers Memorial Hospital. And there are several campuses, and you can find out more. During Mental Health Month, we encourage you to help spread the message about the importance of addressing mental health concerns early, because with proper treatment, as we discussed, and support, millions of people are able to achieve recovery. To learn more, you can go to Rogers' website. It's rogershospital.org, or you can call this toll-free number. It's 1-800-767-4411.